My name is Dr. Thomas Schuler. I'm chairman of the Medical and Scientific Board of the National Spine Health Foundation.
Hi, I'm Thao Allen. I'm a fellowship-trained physician assistant.
So we talk about physical therapy and doing the right thing is so important. So how does a patient find good therapy? How do you recommend people to therapy? And what is good therapy?
Sure. You have to find a physical therapy facility that has a good reputation. That means it's not just the facility itself, but you're going to an actual physical therapist. And so when you meet that physical therapist of yours, you should have a good relationship of communication. You should be able to share what you're going through and also to give feedback and be comfortable to share with your therapist that, you know what, that session last time really hurt me. It was really too much. So the therapist can understand on how to guide the treatment. So that's really important. And also that you should be making progress. Of course, all medical practitioners are very nice and they do a great job and they mean well, but the important thing is that you're getting progress and you're getting benefit from the time invested with your physical therapist.
I think that is such a critical piece of information is, people are like, how long do I have to go to therapy? How long? And for me, if you go to therapy 3 days a week for 2 weeks and haven't seen progress, it's either not the right program or not the right therapist. And so it's not that you need to go to a treatment for months to see results. You should see results within 2 weeks if you're truly involved and you're working at it and they're working at it within 6 sessions, which typically would be 2 weeks. But in that time, if you don't see progress, that's not working, that's not the right center to get your treatment, that's not the right answer. Now, it doesn't mean that we solve all problems in that time, but we should know. And the other thing is, if you don't make progress in that time, then it also says to go back to the healthcare provider and say, what else do we need to do? And maybe this is why you need an injection, a diagnostic test, or some other treatment. But if a therapy program is going to work, it won't solve it in 2 weeks, but you will see progress within 2 weeks. And if you don't, it's wrong. But as Thao said, I think that making sure that you have a conversation with the therapist, not with an aide, not with a tech, but with a therapist, a quality therapist. I think manual therapy is the key part, which this is where the therapist puts their hands on you and they help mobilize the tissues and understand it to say, where is the problem? And then they add in other modalities, whether it's a dry needling or a laser or some other treatment to help with the problem in addition to strengthening and flexibility. But ultimately, when people come in, we have to break down to the basics and make sure they're doing the very fundamental basics right and then moving up. And I have to tell my own story. I had hip surgery and I had my hips fixed. I'm gonna start this again. I have to tell my own story. I had a bad back problem a few years ago and my back blew up. I got very sick and I couldn't exercise. And so I took about 2 months off of my program. And then I jumped right back in at the level I had left, and my back couldn't handle it, and it blew up, and I became horribly incapacitated. And I had to go back to work with the therapist and go down to the basics again before I could get to where I could function better. And I needed some extra treatment, I needed a little injections and some medicine, but I eventually was able to get back to where I was before. But even I, an experienced pro in this field, didn't understand that a hiatus because of an illness knocked me out of my game and I lost everything I had and I ended up in severe pain. So I think that it's critical to understand that even if we're athletes and we feel very competent in an area, that we need to get to those basics again. And it's kind of like spring training every time. Okay, I've had a problem, let me go back to spring training and start again. And that's been my experience. And I've been fighting this for decades with my own body. And so I get to walk the walk and talk the talk that I ask my patients to do every day.